So, Dr. Auerbach, we talked about the problems missing teeth can create. One of the ones was the DMJ and the headache which it creates with it, teeth inside shifting and losing bones and all that type of stuff, and the shifting teeth, then not looking so good maybe. So what can we do? What are some of the options out there? I'm sure we are aware of some of them, but give us the 2 or 3, major options, and give us a little bit the pro or cons for each one of them, just a little bit on a big level.
Sure. Well, probably the ideal way, unless there's some problem with the bone or medical issues, would be to replace that tooth with a fake tooth called an implant. It takes the place of the root, and you put a crown on it. And you're able to keep stimulating the bone and keep that thick, and it replaces one or more teeth with multiple implants or the single implant. That would probably be the number one choice. There are other options. If there's a tooth on either side of the space where the tooth is gone, you can connect them together just like a bridge goes over a river. We could connect one tooth to the other and make a bridge go over the missing tooth, and you could have 3 teeth, and it's one piece, but it looks like 3 teeth. Those are the 2 best scenarios. Another option is something that can be taken in or out to replace the tooth. It'll hook onto the teeth that are there. And the problem with that is food can get underneath it. It can put extra stress on some of the teeth the way they're designed. They're not as ideal as the bridge, but it is better than nothing to keep and maintain stuff. Those are the 3 options that you can have.
Well, it looks to me that the bridge and the implant are the thing which people on an average choose. Now, so what are some of the advantages, even including financially also, what are some of the advantages and disadvantages of either one of those ones, bridge or implant? Let's talk about those 2.
Sure. Well, the advantage of the implant is that you don't have to work on the teeth on either side. So the implant is self-supported, so it takes care of all of that. The bridge, the advantage of a bridge is that it's solid just like the implant. The disadvantage of the bridge is that it is connected to 2 other teeth. And if something should happen to one of those teeth, then the entire bridge is no longer any good and would have to be replaced. So that's the advantages and disadvantages there. As far as cost, the total cost for them is about the same. Whether you do the 1 implant and its crown or you do the bridge for 3 units where you take the teeth on either side and basically prepare for crowns and put the bridge on, your total cost is about the same.
I got it. And probably that becomes because when you do a bridge, you have basically 3 crowns, 3 of those caps, which are ceramic caps and whatever they are, whether they're gold layered or not, but they cost X amount of money, and that's where the extra cost comes in. It makes even for the titanium implant which you put in the one. So you mentioned something about if one fails on a bridge, then they all fail. When you grind, you need to grind those 2 teeth on the side where the missing tooth is. You need to grind them down to put this cap on it. Does that grinding down kind of predispose that one of those teeth to fail more easy than they otherwise would if you never grinded them?
Yes, it does. I mean, we do make our crowns to fit really as snug as possible, but if a tooth is worked on, then it's a little weaker. There's always that edge, be it however microscopically small, bacteria or even smaller, that could get up underneath something and cause them to fail. Nothing ever lasts forever.
Well,
so the less you have to work on a tooth, the better.
Right. Since you mentioned lasts forever, there might not be real numbers out there because the implants, frankly, haven't out. Basically, we don't know how long they last to a certain degree because they're still all in it, even though they have been put in 10, 15, 20 years ago in most cases. So what is the average, or at least the consent out there about the longevity about a crown, a bridge versus an implant?
Okay. Bridges and crowns, for that matter, probably have an average lifespan of 10 years. Implants, like you said, they don't fail because of any cavities. Maybe some of the porcelain will chip, but their longevity is probably closer to the 20-year mark, and still going. Like you said, they're doing awesome.
Wonderful. So basically, if we just look at money, which isn't the only thing to look at, but it's there. Your implant, even though it more or less costs the same if you have a 3-unit bridge versus a 1 implant, it more or less is the same money, but it then actually lasts much longer. So never mind the hassle of going in there and doing something again, it also lasts you long. And of course, once that bridge fails, now that you grinded them down, you now might have to do more bridges, a bigger unit, or more implants. So actually you increase the cost 20 years down the road or 10 years down the road when it does fail, right?
Right, that's correct.
Right. Is it true that one of the reasons bridges sometimes have a tendency of failing more is because, as you said, it's really one piece, kind of like welded together, not really welded together, it's just made in one piece, but because it's difficult to clean it, and you need to go with the floss underneath. So if you have a slightly slappy guy like me, when my wife and me go to the bathroom, we start, she is flossing, still flossing. I already finished shaving, flossing, brushing, and showering. I'm done. She's still brushing and flossing. So obviously, if I would have to be very diligent about my cleaning with the floss and stuff, chances are that every so often I go, not today, not today. And would that kind of enhance the chance of the bridge failing much more? You basically develop gum disease and then it fails?
Absolutely, because you need to keep it clean. You need to keep the plaque off that has the bacteria in it that are producing acids that eat up the tooth structure. And if you don't get that off, you can get a cavity underneath the bridge, and that could cause it to fail.
Okay.
So, definitely.
Good. Well, all right. So here you have it. So one way or the way the tooth should be replaced. Implant is a pretty good thing to do. At the same token, the crowns, the bridges are workable, have done a good job for a long time, and could be done still.
Correct. And usually those cases are the ones where maybe there's some medical issues and we can't work on the bone. So we work with the teeth that are there. But probably for the last 15 years, the standard of care is to get the implant in versus doing the bridge.
It's quite funny why we even, to a certain degree, in this case, question, well, maybe we question, is it really the standard of care as patients or so? But obviously everything else, whether it's a computer, whether it's a car, anything, we always want the new standard, the new what's the best, whether it's the new washing machine, wouldn't matter. We want the newest. Why are we questioning to get the newest in the body? And maybe we're not. I'm sure when people hear an implant and even to a certain degree, sometimes if there's only one tooth missing, the cost isn't really much different, then it's probably an obvious thing to go. But the most important thing looks to me from the video before that a missing tooth can cause havoc is that a person does something.
Right.
Good. Thank you very much, Dr. Auerbach.